Today on Real Rescues, Richard is having a heart attack. His treatment is about to break a few records. He'll be undergoing life-saving surgery within 20 minutes.
That we're holding off with giving you the drug that we've got because we're going basically straight into surgery.
A family's day out comes to a terrifying end when their car spins across 3 lanes of the motorway, leaving Mum worried sick about her 5-week-old baby.
We've got an ambulance coming. Calm down. Fine, go on. Go on.
And we're out with the specialist animal rescue team as they strive to save a child's beloved pony stuck in a flooded river. These vehicles are just like a very compact and mobile A&E department. In an emergency, they have all the equipment needed to check out just what's happening to our bodies if they start to go wrong and to begin the process of getting us better. The rescue we're about to see shows what happens inside when someone's in the middle of a heart attack. 4 highly trained ambulance crew are working flat out to save this man's life.
So my colleague said that you had been jogging, had you?
Yeah.
Right, OK. And what happened?
I was fine.
Right.
Came in, had a cup of tea, had a shower and a shave.
Right.
I just finished getting dressed and I started to get these pains in my chest.
OK.
I hoped it would go away,
Right.
but it got worse.
Richard is conscious but in pain. He's 64 and a TV presenter with British Forces Broadcasting.
Oh, can I lie down, please?
Yeah, can you just lean forward for me a wee bit? That's it. Bring your shoulders back. That's it.
The crew are getting an electrical reading from Richard's heart, which will tell them exactly what's happening.
Right. Let's get the...
Looking at our ECG, it's a good indication that you've had a heart attack. Okay, but we've got, as I explained before, we've got some drugs that we can give you now to start busting those clots, okay?
So the treatment can get started right away. The clot-busting drugs could save Richard's life, but they're not without risk.
All right?
Yeah.
We'll give you some more pain relief as well, and then we'll be on our way to hospital. But the sooner we start the treatment, the better.
Okay.
All right?
Every second counts. However, paramedic Lucy Dobson must get a full case history to determine if Richard can take these drugs.
Richard, sorry, would you say that the pain came on
Right.
gradually over a second a minute?
Yes, yes.
Lucy tries to be as quick as possible. Richard's in a lot of pain. Meanwhile, paramedic Tom Hope is going ahead and preparing the injection. However, before it's administered, Lucy must explain the possible side effects of this drug.
Okay. Treatment at this stage saves life of about 4 patients in every 100 we treat, but it can sometimes cause serious bleeding. The biggest risk is stroke, which about 1 patient in every 200. Some patients have...
It's vital this protocol is followed, although it poses a real dilemma for Richard.
Okay, do you understand what I've said?
No, I don't think I want the injection, thank you.
Right. Okay.
Jameson's in, isn't it?
Okay.
Okay, should we get going then?
Might as well.
The ambulance crew must abide by Richard's decision not to have the injection. They have to take a different approach. By now, his wife Claire has arrived in the ambulance.
Continuity, basically.
Hello.
Hello. You just got here in time? Yeah. Right, we're going to take Richard around to QA's hospital.
Okay.
And Richard, it's very clear that you've had a heart attack.
Really?
Period.
Yeah.
And, you know, it's your right, but you've declined for us to give you the drugs that we need to blast the clots out.
What? He's declined.
Yeah, I mean...
Well, they said I could have a stroke because of it.
Well, it's a side effect, you know, side effects are, you know, all drugs have side effects which can happen to a small minority of people. We have to inform you of that. But what we're trying
As Claire is being updated, the matter of the drug becomes irrelevant. The hospital has radioed through. The cardiology team has a slot free. If the team can get him there quickly enough, he can go straight into theatre.
You all right then, Richard?
Yeah, everything was okay.
Which was happening, I've spoken to the consultant at the hospital and we're going straight to the cath lab, alright? And what that basically is that we're holding off with giving you the drug that we've got because we're going basically straight into surgery. They basically do a quick x-ray of the heart, find exactly where the blockage is, then they put basically a wire which goes sort of via your groin into the artery that's concerned, and then they basically, you know, blast it away. Alright?
What if I really have had a heart attack?
that you have.
It's a lot for Richard and Claire to take in. Every minute that passes, Richard's heart could be dying. For now, the crew have done all they can.
We caught everything in time. We got there quickly, done our bit. Hospital will do their bit, and you'll be up and jumping around before you know it.
I hope so.
I'll tell you, we'll hand over in there then, shall we? And then do
Cardiologist Dr. Philip Strike and his team are waiting for Richard as he arrives at the hospital. His life is now in their hands. We'll stay with Richard as they carry out the surgery that he so urgently needs. We're back with 64-year-old Richard Astbury. Less than an hour ago, Richard started to have chest pains.
I can't believe I had a heart attack.
We're going to just wire you up and have a look. And if your ECG looks...
Thanks to the swift response of the ambulance team, he's now already in the hospital cath lab, being prepared for surgery to clear his arteries of the blood clot that caused it. Dr. Philip Strike's in charge.
That's going down little tubes into the artery, take some pictures of the coronary artery, see where they're blocked, and then aim to put a little wire across the blockage, stretch it open with a balloon and put a stent in to open that artery up, okay? Good.
That's if I really have had a heart attack.
That's if you really... Well, the angiogram should tell us, okay? Right, can we have a little bit of sleepy medicine? And,
With their part of the emergency complete, the ambulance crew can now relax.
You're in great hands now.
All right, thank you for all this. I'm really grateful for what you're
That's
doing.
all right, that's all right. There we go. Thanks.
Is that Tom?
It is.
You look different upside down.
I'm sorry.
I expect your wife says that sometimes.
Yes, I'm sure she does. Well, we'll ask her in a minute, shall we? You know, the gold standard is to go to a cath lab to have the procedure done in hospital, have the balloon put in, you know, to get rid of the clot that way. That's the gold standard. But sometimes that isn't always available. They have their elective surgery that they're taking place, so sometimes it's not available.
Unusually, they get the chance to see this treatment through from behind the screen of the control room. Richard has been given a local anaesthetic, but he's still wide awake and talking. He's able to move his legs, and this is giving the doctors a few problems.
Look, stop. You're going to need to stop moving, so moving slowly. Relax. Look, you're fighting me. You're making my life much more difficult.
I'm so sorry. I'm so sorry.
Philip is trying to feed a wire into Richard's groin to do the angioplasty. He can see what's happening inside the body on a nearby screen. Ambulance crew Lucy and Anne can also follow the procedure.
I'd say about 14 stones, yeah. Is that just where the block is?
Yeah, here.
Ah, right, yeah.
You can see it.
Yeah.
So distinct.
Yeah, it is.
There can now be no doubt at all that Richard's heart attack is for real.
That is a
The main artery down the front of his heart is totally blocked by a blood clot. The next job is to open it up.
Team works, I reckon.
On the monitor, the special balloon inserted into the artery to stretch it is clearly visible.
We're doing very nicely here, we're very happy. Yeah, we've got that blocked artery open. It's looking lovely. You're behaving.
They then use a special catheter to suck the blood clot out. It's the first time the ambulance crew have seen this operation and they're fascinated.
So what you do then, you just pass.
No, they've already done the balloon up here. So then after they've done that, they get a special catheter in just to see if there's anything at the bottom of the artery, and then we draw the blood back from the bottom of the artery just to see if there's any part that's been moved along by the balloon.
I see. It's amazing, isn't it? They make the time not operated. The time is just...
They can see for themselves that the artery is now completely clear.
How are you? Are you comfortable? Is that pain any better? It should be. That artery's wide open now. We're very happy.
Next, the surgeons need to check how strongly Richard's heart is beating.
Breathe normally. Hot flush coming your way.
They're pushing X-ray dye into the heart's main pumping chamber to make sure all's well.
You're finished. Okay? Good. So you did have a heart attack? And the main artery down the front of your heart is completely blocked. But you can get a bus down in there. Okay.
As the doctors leave, we stay with Richard. He's been given his life back, but he's going to have to change it as well.
That was a bit of a frightening experience, wasn't it?
Well, yeah, they said I could have died.
In the hospital cath lab, heart attack patient Richard Asbury is recovering after undergoing an emergency procedure.
Did you see much of what happened?
Yeah, I saw the whole thing.
Did you really? I'm very glad I didn't, because I'm a bit squeamish.
You're feeling okay now, are you?
Yeah, I feel a bit weak.
So this chap's had pain in his chest, and we brought him straight to the catheter lab. We've done a test called the coronary angiogram, first of all, to look at the coronary arteries, the arteries that give the heart its own blood supply, and see if there's any narrowings or blockages there. We put a wire down the blocked vessel, and we stretched that open with a balloon, and then we used a special catheter to suck out any blood clot, and that restored normal flow to that artery. And it was only 26 minutes from when he arrived in the hospital to having that artery open again, so we're quite pleased with that, and that's a good treatment for him.
It's less than an hour since he first had chest pains, and already he's getting back to his old self.
Can I just ask you a few questions for our notes? Past medical problems, diabetes?
No.
High blood pressure, high
It's
cholesterol?
diabetes insipidus,
Okay.
which is very different from sugar
I
diabetes.
know what diabetes insipidus is. High blood pressure, high cholesterol?
Well, yes, but it's under control because of the medication I
Okay.
take.
Any heart disease in the family?
No.
Okay. It's
I
fine.
like a drop of gin.
Okay. Not today.
No.
Alright, thanks very much.
It's been a life-changing experience for Richard.
I was frightened. I was very frightened indeed, because I'd been told that I was having or had had a heart attack, and who knows, you know, first thing I thought to myself, am I going to be able to work again? Can I walk again? And the biggest thing, the thing that frightens me now, even now, after the heart attack, is it likely to happen again?
Well, there seems every reason to be optimistic. The surgeon, Phil Strike, explains how the operation has not just unblocked an artery, but it's substantially limited permanent long-term damage.
So this is a picture of his left coronary artery, and this is the artery that runs down the front of the heart, so it's called the left anterior descending artery, and there's an area here which is very severely narrowed and virtually blocked, and there's a side branch just coming off here which is almost completely blocked as well. And if we then just show you how we left it at the end in a second. And then when we finish, we've opened that area completely, and there's a stent in there now, so nice flow down that artery all the way down. And we've put a balloon in this branch here, which looks better. It's not perfect, but I think the most important thing is to have a good result in this vessel, because that's what's going to keep him alive and stop him having any further heart attacks. And if we look at his heart at the end of our procedure, then the heart still is nice and strong, it pumps very well. There's maybe a little area at the bottom which has been damaged. So the amount of damage he's had is actually very small, so he's had a very nice result, and we're very pleased with that.
With any luck, Richard will be back home in a few days' time. He's going to have to make some changes to his lifestyle to avoid future problems. We'll be with him to find out what he's learned from this experience. Now some news of Richard, 8 weeks after his heart attack. He was out of hospital and back home just 3 days after his operation. He's getting back to his old self now, but he's determined to learn the lessons from that day.
I'm not having my gin. I'm cutting down on my consumption of alcohol, which was, you know, bigger than it should have been. So I'm restricting myself, and I feel slightly as if I'm in a sort of straitjacket of life. But I've been told by the cardiologists that I'll be back to normal in a few months.
And it'll be a new reformed Richard.
Only 4 weeks before I had my heart attack, I was told by my GP that I had a 15% chance of a stroke or a 25% chance of a heart attack. But, well, That was the warning. This is not a warning. This is a big wake-up call.